If your heart suddenly starts racing, don't ignore this video, because there is one simple technique that, in certain situations, may help stop a rapid heartbeat in just seconds. What's surprising is that most people have never heard of it. But before you try anything, there's something important you need to know. Not every fast heartbeat has the same cause. Some episodes may pass quickly, while others could be a sign of something more serious. So, when is a racing heart something you may be able to manage safely, and when should you seek immediate medical attention? In this video, you'll learn about a technique that has helped stop certain episodes of rapid heartbeat, how to perform it step by step, and the warning signs you should never ignore. Make sure you watch until the end, because this information could one day be important for you or someone you care about. The condition we're talking about today is called Supraventricular Tachycardia, or simply SVT. SVT is a type of abnormal heart rhythm that causes the heart to suddenly beat much faster than normal. In many cases, the heart rate can jump to 150, 180, or even more than 200 beats per minute. To put that into perspective, a normal resting heart rate for most adults is usually between 60 and 100 beats per minute. So when SVT occurs, the heart can suddenly begin beating at nearly twice its normal speed. What makes SVT unique is that it often starts without warning and may stop just as suddenly. One moment, everything feels completely normal. You may be sitting, walking, or even resting. Then suddenly, your heart begins racing. Some people describe it as a pounding sensation in the chest. Others notice fluttering, palpitations, lightheadedness, shortness of breath, or a feeling of anxiety. Then, sometimes within minutes, or sometimes after much longer, the episode ends and the heartbeat returns to normal. Because the episodes can come and go so abruptly, many people are left wondering what just happened. The good news is that SVT is often not immediately life-threatening in otherwise healthy individuals. However, it can be extremely uncomfortable, and recurring episodes should never be ignored. That's because other heart rhythm problems can sometimes cause similar symptoms. Getting the correct diagnosis is important so you can understand what's happening and know the safest way to respond if it happens again.
Medical guidelines suggest that when a person is experiencing a stable episode of SVT, there are certain techniques that may help slow down or even stop the abnormal heart rhythm. These techniques are known as vagal maneuvers. Vagal maneuvers work by stimulating the vagus nerve, an important nerve that helps regulate many automatic functions in the body, including heart rate. When activated, the vagus nerve can influence the electrical signals traveling through the heart. In some cases, this can interrupt the abnormal electrical circuit responsible for SVT, allowing the heart to return to its normal rhythm. Among the various vagal maneuvers available, one method has attracted particular attention because of its effectiveness. In fact, research has shown that it can work better than the traditional approach used for many years. It's called the Modified Valsalva Maneuver, and for people experiencing certain episodes of SVT, it may significantly increase the chances of restoring a normal heartbeat.
Researchers have found that the Modified Valsalva Maneuver is significantly more effective than the traditional version. In fact, studies have shown that modifying the body position immediately after the maneuver can greatly improve the chances of restoring a normal heart rhythm. The idea behind the technique is actually quite simple. For a short period of time, you increase the pressure inside your chest by straining in a specific way. This temporary change in pressure can stimulate the vagus nerve, which plays an important role in regulating heart rate. When the vagus nerve is activated, it may slow the electrical signals passing through parts of the heart, and in some cases, interrupt the abnormal electrical circuit responsible for SVT. As a result, the heart may return to its normal rhythm. You can think of it as pressing a reset button for certain types of rapid heart rhythms. Of course, it doesn't work for everyone, and it isn't designed to treat every cause of a racing heart. But for some episodes of SVT, it can be surprisingly effective. The most important thing to remember is that the technique must be performed correctly to achieve the best results. So let's take a closer look at exactly how to perform the Modified Valsalva Maneuver, step by step.
First, make sure you're in a safe place where you can sit or lie down comfortably. If possible, avoid standing while performing the maneuver, especially if you're feeling dizzy or lightheaded. Begin by taking a normal breath. Then, close your mouth, pinch your nose shut, and try to forcefully exhale as if you are blowing air out. The important part is that no air should actually escape. You should feel yourself straining, similar to the sensation of trying to blow up a very stiff balloon. Maintain this pressure for about 15 seconds. Try not to stop too early, as maintaining the strain for the recommended amount of time is an important part of the technique. After the 15 seconds are complete, quickly lie back if you are not lying down already and raise your legs for about 15 seconds if possible. This change in body position is what makes the Modified Valsalva Maneuver different from the traditional version. Researchers believe that this additional step helps increase blood flow back to the heart, which may improve the chances of triggering the body's natural reflexes that can restore a normal heart rhythm. After about 15 seconds, lower your legs and return to a comfortable resting position. Then give your body a moment to respond. For some people, the heart rhythm may return to normal within seconds. For others, the maneuver may not be effective. It's important to remember that this technique is intended for certain stable episodes of SVT, and it should not replace professional medical evaluation. If your symptoms become worse, if you experience chest pain, severe shortness of breath, loss of consciousness, or if you feel as though you might faint, stop immediately and seek medical attention right away.
Not every fast heartbeat should be treated at home. While some episodes of rapid heart rhythm may be relatively harmless, others can be a sign of a potentially serious medical condition. That's why it's important to pay attention not only to how fast your heart is beating, but also to the symptoms that occur along with it. You should seek emergency medical help immediately if your racing heart is accompanied by chest pain, shortness of breath, fainting, severe dizziness, confusion, or loss of consciousness. These symptoms may indicate that your heart is not pumping blood effectively, or that another serious heart problem may be occurring. In some cases, a rapid heartbeat can be associated with conditions that require immediate medical treatment. And while it's impossible to know the exact cause without proper evaluation, it's always safer to treat these warning signs seriously. Remember, your body is sending you important signals. If a racing heart is causing significant symptoms, or if something simply doesn't feel right, don't wait to see if it goes away on its own. Getting prompt medical attention could help prevent complications, and in some situations, it could even save a life. There are also other vagal maneuvers that may help in some situations. While the Modified Valsalva Maneuver is often the most widely discussed, it is not the only technique that may stimulate the vagus nerve. For example, some people may find that forceful coughing can help trigger a vagal response. Others may respond to applying a cold pack or splashing very cold water onto the face. This sudden exposure to cold can activate natural reflexes in the body, which may influence heart rate in certain individuals. These methods work on the same basic principle, stimulating the vagus nerve in an attempt to slow down the abnormal electrical activity causing a rapid heartbeat. However, their effectiveness can vary significantly from person to person. What works for one individual may not work for another. It's also important to be cautious when searching for advice online. You may come across other techniques that claim to stop a racing heart quickly. One commonly mentioned example is massaging the carotid artery in the neck. Although this maneuver has been used in medical settings, it should only be performed by trained healthcare professionals. The carotid arteries supply blood to the brain, and improper pressure in this area can potentially lead to serious complications. For that reason, it is not considered a safe DIY technique. The safest approach is to focus on methods that are generally considered appropriate for self-use, while seeking medical evaluation if episodes continue to occur, become more severe, or are accompanied by concerning symptoms. Remember, a racing heart can have many different causes. Understanding the cause is just as important as knowing how to respond when it happens. If vagal maneuvers do not work, the next step may involve medical treatment. One of the most commonly used medications for certain types of SVT is called adenosine. Adenosine is administered through an intravenous line, which means it is injected directly into a vein. Because it works so quickly, it is typically given in a hospital, emergency department, or other medical setting where healthcare professionals can closely monitor the patient. What makes adenosine so remarkable is its speed. Unlike many medications that may take minutes or even hours to produce noticeable effects, adenosine can begin working within seconds. Its job is to briefly slow the electrical activity passing through a critical area of the heart. By doing this, it can interrupt the abnormal electrical circuit responsible for many episodes of SVT. When successful, the rapid heartbeat may suddenly stop, and a normal rhythm may return almost immediately. For many patients, the change can be dramatic. One moment the heart is racing uncontrollably, and the next it is beating normally again. Because adenosine acts so rapidly, some patients describe experiencing a brief but unusual sensation when the medication is administered. This may include a feeling of warmth, chest pressure, flushing, shortness of breath, or the sensation that the heart briefly pauses. Although these sensations can feel strange or even unsettling, they usually last only a few seconds before disappearing. Healthcare providers are trained to monitor patients carefully during this process, and these temporary effects are generally expected. Because adenosine has powerful effects on the heart's electrical system, it should never be used without proper medical supervision. It is a treatment designed for specific situations, and healthcare professionals must first determine whether it is appropriate for the patient's particular heart rhythm. For many people with SVT, however, adenosine can be an incredibly effective tool, capable of restoring a normal heartbeat in a matter of seconds.
If the episode continues despite vagal maneuvers, medical treatment may be necessary. While some episodes of SVT stop on their own, others can persist for a prolonged period of time, causing ongoing symptoms and placing additional strain on the heart. When this happens, healthcare providers may need to intervene to help restore a normal rhythm. The specific treatment depends on several factors, including the type of rhythm disturbance, the severity of symptoms, the patient's overall health, and whether the person is stable or experiencing signs of a medical emergency. In some cases, doctors may use medications designed to slow or interrupt the abnormal electrical signals causing the rapid heartbeat. These medications can help restore a normal rhythm or control the heart rate until further treatment is provided. However, if the rapid heartbeat is causing significant symptoms or if other treatments have not been successful, another option may be electrical cardioversion. Electrical cardioversion is a medical procedure that delivers a carefully controlled electrical shock to the heart. The goal is to briefly interrupt the abnormal rhythm, allowing the heart's natural electrical system to regain control and restore a normal heartbeat. Although the idea of an electrical shock may sound frightening, the procedure is performed in a controlled medical environment with trained healthcare professionals monitoring the patient throughout the process. In many cases, patients receive medication to help them remain comfortable during the procedure. The good news is that electrical cardioversion has been used for many years and is considered a standard, safe, and highly effective treatment when medically indicated. For many patients, it can restore a normal heart rhythm within moments, especially when other approaches have not been successful. The most important thing to remember is that persistent episodes of rapid heartbeat should not be ignored. If symptoms continue or become more severe, professional medical evaluation is essential to determine the safest and most appropriate treatment.
For people who experience recurrent episodes of SVT, there may be a long-term solution that goes beyond simply treating each episode as it occurs. It's called catheter ablation. Catheter ablation is a specialized procedure designed to address the underlying cause of many forms of SVT, rather than just managing the symptoms. The goal is to identify the abnormal electrical pathway that is triggering the rapid heart rhythm and eliminate it. During the procedure, specially trained heart rhythm specialists guide thin, flexible tubes called catheters through blood vessels and into the heart. Using advanced mapping technology, they can locate the tiny area of tissue responsible for the abnormal electrical signals. Once the source has been identified, energy is delivered through the catheter to destroy or isolate that small area of tissue. By eliminating the abnormal pathway, the heart's electrical system can often function normally again. One reason catheter ablation has become increasingly popular is that it targets the problem directly. Unlike medications, which may need to be taken for years and may not prevent every episode, ablation offers the possibility of a more permanent solution. For many forms of SVT, the success rates are very high, and many patients experience little to no recurrence after the procedure. In some cases, people who have struggled with sudden episodes of rapid heartbeat for years are able to return to their normal activities without worrying about future attacks. Of course, every medical procedure carries potential risks, and not every patient is a candidate for ablation. That's why decisions about treatment should always be made in consultation with a healthcare professional who can evaluate your specific situation. Still, for many individuals living with recurrent SVT, catheter ablation has become one of the most effective treatment options available, and in many cases, it can potentially provide a permanent cure.
One reason proper diagnosis is so important is that not every rapid heartbeat is SVT. Another common rhythm disorder is called atrial fibrillation, or AFib. SVT typically feels very fast, but usually regular, like a steady drumbeat. AFib, on the other hand, often feels irregular. The heartbeat may seem chaotic, unpredictable, or uneven. Because treatment approaches can differ significantly, an ECG or electrocardiogram is often needed to confirm the diagnosis. If you've experienced episodes of sudden rapid heartbeat, don't ignore them, even if they stop on their own. Talk with your healthcare provider. You may need testing, such as an ECG, a Holter monitor, or further evaluation by a heart rhythm specialist. And remember, while certain vagal maneuvers may help some cases of SVT, they are not a substitute for proper medical diagnosis. A racing heart is sometimes harmless, sometimes treatable, and occasionally a sign of something serious. Knowing the difference could make all the difference. If you found this video helpful, please like, subscribe, and share it with someone who might benefit from this information. Thanks for watching, and take care of your heart.